Fibroadenoma is a non-cancerous breast lump. That means it's a lump in the breast or a mass in the breast which will not spread and go to different parts of the body like a cancer. This fibroadenoma incidence is around 40%, and in India it is way higher than the other countries. When we compare all the breast cancers, fibroadenoma actually is commonly seen in the age of around 25, that is in young women, and it accounts to almost 60% of the lesions which are seen. So there's a lot of importance of fibroadenoma in our country, where the incidence is very high when compared to women in the other countries. Fibroadenoma does not have an exact cause. It is predominantly hormonal driven. Most of the hormonal activities that keep changing month to month on women, that could be the cause of fibroadenoma, but there is no specific cause that this happens and you develop fibroadenoma. For the question, can it become cancerous? Namaste, I am Dr. Rohit Madhurkar. Fibroadenoma is a non-cancerous breast lump. That means it's a lump in the breast or a mass in the breast which will not spread and go to different parts of the body like a cancer. This fibroadenoma incidence is around 40%, and in India it is way higher than the other countries. When we compare all the breast cancers, fibroadenoma actually is commonly seen in the age of around 25, that is in young women, and it accounts to almost 60% of the lesions which are seen. So there's a lot of importance of fibroadenoma in our country, where the incidence is very high when compared to women in the other countries. Fibroadenoma does not have an exact cause. It is predominantly hormonal driven. Most of the hormonal activities that keep changing month to month on women, that could be the cause of fibroadenoma, but there is no specific cause that this happens and you develop fibroadenoma. For the question, can it become cancerous? No. The chance of fibroadenoma becoming cancerous is very minimal, almost less than 1% or so. But even there are questions, people would think that, I have multiple fibroadenomas. Can it become cancerous in future? No, the chances of fibroadenoma becoming cancerous in future is very less. But if you see a complex fibroadenoma on routine follow-ups, when we are doing scans, when you're getting your breast scans, mammogram, there is change in characteristics of the fibroadenoma, or the fibroadenoma is getting bigger in size and losing its contour and shape and the way it looks on ultrasound, that is called sonomammo or mammograph, or even in MRI, then we start thinking about going to have a malignant potential in future. So this is the point where you have to note down and then make sure that if there is any form of changes, then it is better to see your doctor at the earliest. So the best tool to identify fibroadenoma in a woman is self-examination. If you check on the internet, browse around, there are hundreds of videos and images and how to self-examine your breast, and women have to keep doing this, and this has to come from mother to daughter, and it has to go from generation to generation, because self-examination of the breast is the key, and that will tell you the first time that you're feeling something different, and that's where you have to catch and then get to the doctor to identify what it is. Once you get to the doctor, they see a breast lump in younger women. First sonomammo is done, that is ultrasound of the breast, which will identify whether there is a breast lump, what is the size and how does it look. So, and then we characterize whether there are different categories, whether this is benign or malignant, and then we tell this is most likely fibroadenoma. When the situation comes that we are not sure whether it looks like fibroadenoma, if in a scale of 1 to 5 it is lying down somewhere in between 2, 3 or 3 plus above, there is a little bit of doubt. The next step for this is ultrasound guided biopsy. So I am seeing this abnormal area on the ultrasound scan. Then we intervention radiologists on the ultrasound scan will identify that zone, take the needle exactly to that location, get there and take a small piece of the tissue and come out. This will not leave any scar on the breast. This will not cause any defect on the breast contours. It is just a small needle which goes in, takes the sample and comes out. Or even if the suspicion is low, we could consider something called as FNA, which is FNA is nothing but getting few cells of fluid from the tissue which is there inside. biopsy is get a small piece of the tissue and that is examined under microscope. And these biopsies tell us a very good assurance that this is not cancerous or this is fibroadenoma, which is benign. So this clarity comes with this kind of protocol. So remember to self-examine, get to the doctor, sonomammo, and then if required, minimally invasive biopsies or FNA can be done for these procedures to identify whether it is fibroadenoma or any cancerous breast lump.